Welcome, everybody. My name is Dr. Glen Pettersen. I'm one of the solution consultants at Athena. I've been with Athena for just shy of 11 years now. I spent the first 5 years on the athenaPractice or centricity product line. The last 6 years, I've been on athenaOne, and I'm much like Tina and Amy. I've never looked back, and so although it may be impossible to show you everything, all the great stuff that athenaOne has within 30 minutes, I'm going to do my best. So, Christy, if you don't mind, I'm going to ask you, let's do a little role play today. I'm going to ask you to play our patient, Larry Lombard. I'm going to share my screen, and maybe we can go through and do an ambient demo for today. So let's go ahead. I'm going to go ahead and share my screen. And right in the middle here, you'll see a picture of my iPhone, and you can see the athenaOne desktop in the back, or the home-based work page, as we call it. This is the athenaOne mobile app. It's on the iPhone store. It's very soon to be coming out in parity on the Android store as well. But right from here, this is really great for providers on the go. So I can quickly see my schedule. I can prepare for patients. I can check my inboxes. Those messages in the middle are also across the bottom, where I can navigate from side to side, and just if I want to look over any of my inbox items. But for today's demonstration, we're going to jump right in, and I filtered down on just patients that are ready for provider. And if you notice, there's a little microphone button right in the middle that says Start Ambient. And I'm going to go ahead and go in with Mr. Larry Lombard, which Christy will play today. And let's go ahead and get started. When I first select Ambient off there, I will confirm with the patient, just get their verbal consent that we will be recording this today. Christy, is it okay if we record the conversation today? This will just help our AI scribe to better document our case.
Just fine.
All right, great. So let's get started, and it'll give me a little countdown here, and then let's get going. So good morning, Mr. Larry. How can we help you today?
Yeah, I've been having increased back pain after a recent injury when I slipped on a wet floor, and now I'm also experiencing numbness and pain shooting down my right leg.
I see. I've been looking over your file, and I know you've been to our clinic before. Is this a similar issue?
Yes, but it's much worse than my usual pain, and the leg pain is quite sharp.
Great. So have you experienced any loss of bowel or bladder control? And could you tell me what makes the pain worse? And have you tried anything to relieve it at home?
Yeah, no problem with using the bathroom. I did try Norco and gabapentin I had left over at home. It only helped a little bit, but changing positions makes it so much worse.
All right, let's go ahead and examine you. All right, on examining you, I found some tenderness in your low back muscles, and you have some limited range of motion. Your straight leg raise test was positive on the right, which supports nerve irritation. There's also some decreased sensation and slight weakness in your right leg. This fits sciatica due to possible nerve compression.
What does this mean, and what can we do?
Yeah, that's a great question. Well, we'll get an MRI scan of your lumbar spine to see if you have herniated disc or maybe other tissues that are pressing on the nerve. Meanwhile, I'll prescribe some naproxen 500 twice daily for a week, taken with food to reduce pain and swelling. Also, a muscle relaxant, cyclobenzaprine, 5 milligrams at bedtime for 5 days for muscle spasm.
What should I watch out for with these meds, and what if these meds don't help?
Now, we'll take the naproxen with food to protect your stomach, and be aware that it can affect your blood pressure. The cyclobenzaprine may cause drowsiness, so avoid driving until you know how it affects you. If the nerve pain continues, we may add in some gabapentin. That'll help.
And if things don't improve?
If your symptoms don't get better, we can do an epidural steroid injection for targeted relief. It's done under image guidance, where we inject steroids near the irritated nerve to decrease inflammation.
What does that involve?
Yeah, the procedure uses X-ray guidance to place a needle into the epidural space and near the affected nerve. You'll be awake, but numbed locally. The injection takes about 15 to 30 minutes, followed by observation.
Is it safe?
Yes, it's generally very safe, but carries a small risk of infection or bleeding. We monitor you carefully and provide instructions after the procedure, though.
Okay, and what else should I do in the meantime?
In the meantime, go ahead and limit heavy lifting, twisting, and prolonged sitting. Used hot or cold as needed. Once the pain is better controlled, you'll go to physical therapy for exercises to strengthen your back. And
when should I come back?
Let's plan to follow up in 1 week to review your MRI and progress. Contact us sooner if your symptoms worsen, especially if leg weakness or bladder issues arise. And thank you very much, Christy. I'll have the medical assistant come in and give you prescriptions, and we'll go ahead and see you. I'm going to go ahead and dictate the rest of my exam. So thank you very much, and it was great to see you again.
Thank you.
At this point, I have the ability to go ahead and pause my note. I can go into my office, and I'll go ahead and dictate the physical exam. Physical exam shows on back examination, the inspection revealed no visible deformities, swelling, or skin changes over the lumbar area. Palpation revealed tenderness over the right lumbar paraspinal muscles and sacroiliac joint. Range of motion revealed lumbar flexion and extension reduced secondary to pain, lateral bending limited on the right. Our special test included a straight leg raised test on the right side, which was positive at 40 degrees, provoking radiating pain down the right leg. The Feber test was negative bilaterally. Our neurological examination included sensory, which revealed decreased sensation to the light touch over the right L5 dermatome. Motor, slight weakness of the right ankle dorsiflexion, grade 4 out of 5. Reflexes, patellar reflex, symmetrical 2+, ankle reflex diminished on the right side. Gait revealed myalgic lean, favoring the right side noted. At this point, I can go ahead and ask this to summarize and send to chart. We'll say yes. This takes anywhere from generally 20 to 60 seconds. And while it's generating that, I'll have a chance to just sign off one of the prescriptions, get ready for the next patient to come in. And then that will parse the note into the different sections. So while this just takes a couple of seconds, I'll generally review the rest of the information. You can see that the exam has been sent over there. The ambient has been grayed out. It says that it's in progress. That means it is sending that note over. I can review it here within the patient's chart, or I can go to the desktop version to review that today. So we'll just give it a couple seconds to let it go through. While I'm doing that, I could also go over and review some of my inboxes here, and I'll review some of this stuff on the desktop, but this does have parity with the desktop. It's used as an extension of this. Certainly can go through and just, so I can see that it was sent over. Let's go ahead and review that. And if you notice now, as I move down, the HPI is dictated in there, or should I say the AI has put it in there. I can review that. I can edit that. I can add in my different macros if I need to. The review of systems was generated. My detailed physical exam is in there, as well as the assessment and plan sciatica on the right side with my plan was put in there as well. So essentially, I'm pretty much done with this patient at this time, and I can go on and move on to my next patient. But that was just a quick demonstration. Let's go ahead and move off of this here. I just want to come off of my, and I want to go into athenaOne on the desktop. And what you're noticing here, and I figured for the rest of the demonstration, which is about 20 minutes or so, let's just walk a patient very quickly through the clinic. We'll check them in very quickly. We'll look at some of the AI that's embedded within Athena. I think that's the focus here. That's top of mind. Just remember, please, if you have additional questions or something you didn't see here today, reach out to Christy. She can get a demonstration scheduled. But the first hat I'll be wearing in the practice is that of somebody sitting at the front desk. And Athena has two versions of this home-based work page. There is a clinical version for clinical staff. I'm starting on the administrative side of things. This is where we'll get patients checked in. I do see a schedule full of Dr. Painter's schedules coming in. There is a secondary view within athenaPractice that is more like centricity style scheduling or athenaPractice style scheduling that does look like something you're used to seeing in athenaPractice, where it's that Outlook style scheduling. So we do have that in athenaOne, but I'm going to be working off another screen today, which is this check-in window. But I also have a task list on the left-hand side, and this is what we call the workflow dashboard. I think Amy was, or Tina was the one that mentioned about task management. athenaOne is really great with task management, meaning everybody knows exactly work needs to be accomplished, whether you're in the visit on the home-based work page. And this task list here drives practice performance, right? It drives scheduling density as well as making sure that claims go out cleanly. So no shows or any patients that did not check in for yesterday's appointment, missing slips or appointments that have been started, but it's not been run through the rules engine yet. We do have a coding service that's not part of the demonstration today, but if you need additional coding services within your practice, we can help out. Athena will also reveal patients that have eligibility issues. We're looking forward in the schedule 3 days and revealing those patients that might not be eligible for care. But I see that, on the right-hand side here in the tracking board, I see patients that some of them are ready for staff. And my attention is drawn over here to my arrived patient. That means they're in the waiting room, but I see Jason Painham walk right through the front door and I can call him over. The prep signal lets me know that the chart prep has been completed by the staff. You can chart prep patients. You can prep patients' charts before they're even arrived at the clinic. So I know that's something we always wanted within athenaOne. Patients standing in front of me, I'm going to go ahead and check them in. Just know appointment reminders have been sent out to the patient via phone call, text, or email. But it's very easy to check patients in. I'm just scroll down the screen and make sure we're billing the proper insurance for today's visit, the assignment of benefits on file, as well as the privacy note, as well as the patient has opted into the patient record sharing feature. That's where we do pull back clinical documents from the Care Quality and Commonwealth networks into the patient's chart. I also have all my highlighted fields captured so I don't have to chase the patient down after the visit to get the billing out. We do have an extremely high portal adoption and utilization rate, almost double the industry standard. I think one of the reasons for that is I can see right here, if the patient's using the portal, the last time they logged in, I can even complete portal registration for themselves, family member, caregiver, parent, child. Before moving down to capturing the patient's picture with the Athena Capture app, I can pop up a QR code and put the picture right in. I'll show you how that's done in the chart if we have time today, as well as I can get a jump on the default pharmacy, lab, and imaging centers that do trickle over to those order and prescribing workflows, which really offload some of the work on the staff, although they can be changed on the fly. In my insurances section, I see the patient is eligible. We should upload an image of the patient's insurance card today, but this patient is eligible, and there's an expected $40 specialist copay today, and no referral is on file. So let's go ahead and down to the patient balances section. This is where it's mandatory for me to collect something. If I put anything less than 100% of the balance, the field pops up for me to dictate why I did not collect the balance in full, but I am a top collector. I've explained to the patient they're aware of the $40 copay, and I can collect that via cash, check, or credit card, which I will collect today via cash. The patient hands me cash. I can print up that receipt right here for the patient. We do use a fully embedded partner named Elevon for collecting credit card payments. This patient is done at check-in right now, which once I hit done with check-in, it signals the staff to let them know that the patient's ready to be seen. And I'm going to go ahead and put on my MA hat right now. So I'll go ahead and jump right into the intake section. Just note that there are some tracking beads across the top that just alert the staff and lets everybody, it tracks the amount of time it takes for the patient to move through the clinic. So let's go into intake. Once again, I said athenaOne is very big on task lists. So now I'm down in the visit, so you can see there's a task list on the left-hand side. Let's just let everybody know that the patient's with me now in exam room number 3. And And there's a task list on the left-hand side. So these are the items that I'm going to document, but I did some of this during prep. And we said the patient's here for some low back pain. I can also put in patient preferences, pharmacy, lab, and imaging centers. Those flow over from check-in. But I also want to indicate for our specialists that this patient was referred over from Dr. Medina. This way, athenaOne will automatically queue up a letter to go back to this provider when we sign off the note at the end of the visit. I can document my vital signs using an import vitals button. I can drag those vitals directly in off those Welsh, Allen, or Midmark devices, as well as document anything by hand that I need to do within here. There's a data reconciliation tab that reveals any mismatches from patient-reported data, typically problems, meds, allergies, and vaccines, or information if the patient went to the local Epic hospital and there's a mismatch versus the chart. I would be able to see if the patient went to the hospital and reported a sulfur allergy, I would be able to review this right here. Some other things, I can document allergies, and there's also medication reconciliation. This is where I can, we pull in a 13-month history from the SureScripts network, and there's even charts synced to dedupe medications. I can see I need to refresh that for today. But essentially, those are the top spots here. I also want to look at any quality measures this patient may be due for. We're going to surface at the time of at the point of care, anything that this patient is due for, outstanding care gaps, so I can get those closed and we drive our quality measure reporting programs. I think I'm done with the intake for this section. I just hit whatever areas I'm addressing. This list is reconfigurable, so you can hide things at the bottom just to make them, just to make it match what your intake workflow is today. But let's go ahead and hit done with intake. And this will bring us back to the provider home-based work page. And if you notice now, Jason has turned this greenish color. And for my providers and staff, we'll be working out of this. And the task list on the left-hand side is, being that I am logged in as Dr. Painter, this is exception-based workflow. So the items in this work list directly need my attention. So anything that's been deemed urgent bubbles to the top of the list by the staff. I can reply back to this. Patient says the medications aren't working. Let's go ahead and reply to sender, and I'll put in one of those quick texts. Let's go ahead and get those. We call those text macros in athenaOne. I can get that back over to the staff to bring them in. If there's any, I can see from right here how many patients are in the office. Encounters or unsigned notes. I did hear either Tina or Amy mentioned a previous issue they had here, but until encounters are signed off, they stay in this work list right here. Patient cases or portal messages or phone notes. And down here, there's some order management that's done in here. And this is one important thing that athenaOne does. We have closed loop order management. So whenever I do a lab imaging or consult, send a patient for order something on a patient, there's a default alarm in there. So it's typically 1 week for labs, 2 weeks for imaging, a month for consults, although those can be changed, but Athena is looking for the results. And if we do not receive the results by fax or interface within the allotted time frame, it drops into the needs follow-up bucket. When labs and imaging do come back into Athena, they drop into this work list here for the provider's review. And I see Jason does have some reports coming in for his lumbar spine, and I do see the herniated disc that's right here. At this point, I can take some different actions. I can close it away into the chart. I can also deem it abnormal or normal and route it along to a staff. I can send it out to the portal for the patient to review, or I can just call the patient now and go over the results. But for today, being that the patient is coming in, we'll go ahead and just close it away into the chart, and it drops off my work list. So this is essentially the task list. Just to mention a little bit about document management, athenaOne is the most connected network in healthcare. We have interfaces with over 630,000 different labs, imaging facilities, and pharmacies. They're all built and maintained by Athena. That means we're trying to bring as much work in through interface, but even in the case where Glen, we send labs and imaging down to the local lab and imaging center, and they don't even have electricity. I'm being funny, of course, but they just fax us the results. What happens that's when Athena's document services comes into play, because upon go live, your fax machine will go silent. We reroute your practice's fax line into an embedded eFax solution within Athena. We then use optical character recognition technology plus human eyes to read every one of those documents. If it's patient related, we attach to the correct patient chart and route along to the proper provider or staff based on the routing rules. If it's non-patient related, or we can't identify the patient or the document or even a local pesky pizza menu, it goes into the fax received bin for the staff to go ahead and collate through. So all of your document management services are now handled by athenaOne, which is essentially your index logic. But as the provider, I see Jason's been waiting for me. He's in pain management room number 1. He's here for low back pain. Let's go ahead and select the patient off the tracking board. Now, when I do that, it drops me down into a patient briefing page. And this is where I get all of the information from a 360-degree view. And it's broken in half. So left side, snapshot of problems, meds, and allergies. Many providers like to customize this and add in different defaults of surgical history. There's also those little tabs along the left-hand edge. So if I want to look at the results from a patient's chart, their MRIs, I slide that open. I can read their results. If I want to look at the med list, I can slide that open as well, or even a problem list. And this one doesn't have any diagnosis gaps, but this is a little bit more of the AI that Athena is doing just to show you a patient that does. We have AI that's actually looking at claims data for this patient, and they're inferring from clinical evidence other diagnosis gaps that we may have. So I wanted to show a patient that had that. And you also notice I can have multiple tabs of Athena up on the top. So if I ever get interrupted and somebody needs to know something, I can duplicate my tabs and go and search for a patient right there. But in the Find button is the first place where I'll reveal clinical documents coming in from the Care Quality and Commonwealth Network. And you see there's some AI summarizing this, and I can ask the patient, well, I see that you were in the hospital not too long ago. What was that? And I know it's in regards to her hand laceration repair, but I can open that discharge summary. I can review that clinical document. I can also reconcile information into the chart. A lot of times that's handled by staff, but we try to reconcile. And Athena assembles it in a table of contents. So if I just wanted to look at procedures, I could filter on that area. On the right-hand side, I see how why the patient's here, how their vitals are trending, and athenaOne pulls back from the assessment and plan, my assessment and plan from the last time I saw the patient. There's also embedded AI tools here, which is called Sage. So if I want to trend pain scales, I can type that or voice that in, and that will give me, if there's multiple pain scales in there, it will track and trend that for me, or multiple results. So I can ask our Sage AI bot what different information I want. The other thing, when I move into the exam itself, right at the top here is I can generate a patient summary. So let me close the tab on the left here, and Athena scrubs and scrapes the patient's chart and presents to me a patient overview. So if I can't remember what's happened with the patient in the past, it gives me this nice overview of what's going on with the patient, all before going into the note itself, which is on the top. I can review in this first tab what was documented by the staff and then start my documentation. And I've already kind of put in some information there. We do have Athena's one's version of Dragon here. So if I want to put my cursor in there and just start it on, I can dictate right in there. I can use the Ambient solution. I can use these best practice templates that come out of the box. This is a 57-year-old male patient that reports today for low back pain that's radiating down their right leg. Go to Review Systems. Microphone off. And you'll notice anything that might have been documented by the staff during prep that's abnormal highlights in red. So it's very easy to allocate some of the work to the staff where they can put in findings, and it's very easy for me to, all before going into my physical exam. I have a template that's come up for low back pain. I went in and pulled in the previous physical exam, and then I can chart by exception today if there's anything different for today's visit. And these templates come out of the box, so you're not building anything within athenaOne, but they can be completely customized. All before going into the assessment and plan. My encounter plan that I first used at the beginning of the visit during chart prep was something called, and it's accelerator within Athena. It's kind of like a simple chart command on steroids. It does a lot more of the work. So it pushed in my diagnosis, my typical orders. Let's go ahead and maybe send the patient over. If I need to add additional orders for a patient, I can go ahead. And Athena is actually using AI and machine learning to review your provider's ordering behavior. So it brings up those most. So it's building an on-demand favorites list. We have embedded dual authentication within here. We'll give the patient maybe some hydrocodone for today. I'll send it out to their default pharmacy, but the patient actually lets me know that they want to pick it up by the Walgreens or CVS by their house, and I can quickly change that on the fly. We do have the dual authentication within here, and also we send the patient a text message to the patient the prescription's been sent. There's alert checking. We also know that it's covered on the patient's formulary and the expected price they'll pay at the pharmacy of their choice. I can sign these orders and get them out. We'll go ahead and sign these to send them out for now, and really finish up the documentation by putting in a return to office. I want this patient to come back to the office in 1 month, and we're going to do an epidural steroid injection. And this information is immediately visible. So we'll say, the patient's going to come back in 4 weeks for injection. And they need to be NPO. This is immediately visible at the checkout counter, so there's no question when the patient needs to return. It also creates an appointment tickler, so if the patient says, well, I don't have my work schedule, can you just call me? It goes into a work list for the staff. Last part of this for the provider is just to go ahead and as I mentioned before, being that there was a referring provider on there, Athena automatically queued up a brief consult note to go back to that referring provider. So it closes the loop. So a lot of the automation that was talked about in the background, this one has a salutation. Thank you for the referral of Jason to our office. Here is the finding. And it pulls different parts of the chart, different parts of the note, all before going into the integrated super bill, where all the appointment summary details come over, the diagnosis flow over from the assessment and plan. The only thing that would need to be put in by a provider is the level of E&M that they did for today's visit. I'll just say we did a 99213. Everything else is mapped in the background within athenaOne. So all of your point of care services, even questionnaires, and all your CPT2 codes for your Medicare billing are all mapped in the background. There is an E&M coder that will give some coding assistance, but for today I'm done with my super bill. I can close the note or route the patient directly for checkout and finish the documentation later. In the last couple of minutes, I know one of the big call outs that was mentioned in there was reporting, and athenaOne does have some very robust reportings from the Insights dashboard, which there's really some great videos on the Athena website of this, but I want to go into the best practice reporting library. And this is where you'll see hundreds of pre-built reports. Let's just take something nice and simple like a time of service collections report. You can run reports in Athena, but you can also schedule them to be ran on any daily, weekly, or monthly cadence. You can also share those with different recipients in your organization. Then Athena will generate those reports on that requested cadence and drop them into your report inbox. Like what much was mentioned earlier in the discussion was the report builder. You do not have to be an HTML coder or a crystal report writer to write reports in athenaOne. You just select the type, the display columns, set the filters, preview and schedule the reports, and they drop into that report inbox. There are a whole host of different financial reports, from a payment mismatch tracking report, which you load in your contracted rates, run this on a daily, weekly, or a monthly basis, I should say. And athenaOne will reveal to you any over or under payments against your contracted rates. There's an activity wizard, which is all things billing, charges, payments, write-off, adjustments, collections, even something as simple as an AR aging wizard. And we'll run this for Dr. Medina. She's our beloved provider within our demonstration environment. And we'll just run an AR report very quickly just to show how easily reports are run in athenaOne. And Athena will bring back the standard 30, 60, 90, 120, although these reports can be customized as much as you'd like. I like to descend these in order. And just to give you total control, you can drill into these hyperlinks here and see every claim that's within that work list right there. And then you can even drill down to claim level detail. So in athenaOne, you always know the whole life cycle of the claim, how the claim was sent out, if the claim was adjudicated, if there's any actions that's been taken on there by the staff. So it's very easy to see all the claim notes. And if athenaOne has received an EOB, either electronically or by paper, we hyperlink it in there. So you always have the ability to review that claim, the EOB coming back. From a quality perspective, there's lots of different reports. There's a MIPS dashboard that you can look at your provider's performance, so you don't have to wait till the end of the reporting period. There's quality management reports that you can go ahead and run quality management reports and show outstanding patients on any of the different adult preventive care lines. Let's just run one real quick, and we'll say we want to see all the patients that are due for an influenza vaccine for Dr. Medina, and I can also drill down to a particular cohort, which gives me the ability now to go ahead and send out a group call campaign. And I know I've gone about 1 minute over, and I'd like to thank everybody for their time.